I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce Dr. Levin. Dr. Levin is a pediatric infectious disease specialist and the medical director for the Ventura County of Public Health. Welcome.
It's good to be here.
Thank you. Let's start by defining influenza. What exactly is influenza?
Influenza is an infectious disease. It's caused by a virus. It's unusual in that regard because it's one of the few infectious diseases caused by a virus that actually has a treatment for it. There are drugs that are pretty effective against it. One of the characteristics of influenza that distinguishes it from something like the common cold is that it's really serious. When you have the flu, for the most part, most people are really knocked flat. They have chills and fever. They have a bad cough usually, oftentimes a sore throat. And you do not want to leave the house. You feel miserable, and it lasts for days.
I know that, at least in my practice, a lot of people don't necessarily take the flu seriously or the desire to protect against the flu seriously. And I don't know whether my statistic is right or not, but I gather in world history, influenza has been one of the leading causes of death, if not the leading cause of death by a virus. For any infection.
It's very serious. It causes, it has a great toll. Even in the United States, and even with the fact that we have immunizations, we still see hundreds of thousands of people hospitalized with influenza every year here in the United States. And we see anywhere from 3,400 to 49,000 people die each year in the United States.
And the other reason why I've had trouble convincing people some years to become vaccinated is because we just don't have a perfect vaccine yet. On any given year, I read statistics of approximately 50% being effective as far as vaccination rates or as far as the effectiveness of the vaccination once they get it in terms of protecting in any given year. Some vaccines are a little more effective than others, but none far greater than that.
Yeah, the usual number is 60% with a range of 50 to 70%. What is not addressed, I think, as well with that is if you do get the flu after having the flu vaccine, it is likely to be milder than it otherwise would have been. But it is a significant problem. One of the weaknesses of the vaccine is that, and the other you're pointing out is that it doesn't last forever. We need to get this vaccine every year. Another side effect of the vaccine is the side effects of the vaccine. And they tend to be pretty mild in general. And it's important when we're thinking about vaccines to compare the side effects of the vaccine not to not getting the vaccine. The side effect of the vaccine should be compared to the side effects of the disease that you're avoiding when you get the vaccine.
How about also a comparison of, and I know it's not the direction you want to steer people, but in terms of comparing side effects of one type of vaccine versus the other. We have a live virus vaccine, a nasal spray that's often used, and we have an injection, which I'm assuming is a killed virus vaccine, or one that will is less likely to cause side effects. Is that generally the case?
Well, I think they both have side effects, but you're absolutely right. They cause different flavors of side effects.
Okay.
The side effects you get from the injectable are pretty much the same as you get with any of the other injections. There can be soreness, there can be a bit of swelling, there can even be sometimes fever associated with it. And that's why it's really wise after you get your shot to take a dose of Tylenol, or 2 or 3 or 4 doses of Tylenol separated by every 4 hours to blunt that effect. Although I'm amazed in my office how often I ask people, because I see pediatric patients 2.5 days a week as well. I'm amazed how often when I ask if their kids have had side effects from the vaccine, and they say no, and these are all the vaccines they get. But the side effects of the nasal spray, which, as you rightly point out, is a live virus, can be very much more in the category of having a very, very minor cold. So you might get a little bit of a runny nose following that, or even a low-grade fever.
I like to point out to my patients that most often the side effect associated with vaccine is none. Usually you don't see anything. You don't see fever, you don't see soreness, you don't see anything. And yes, there are a handful of people who can get these, but primarily most people don't have any problem with the vaccinations.
That's been my experience.
How about for protecting little babies? Because there currently is no vaccine that is approved for children under 6 months of age. What are we going to do to protect these little ones?
Well, the vaccine, as you're implying, is not to be given until someone gets to be 6 months of age, and then it can be given throughout the rest of the lifespan. But in the first 6 months, the best way to protect a baby, and we all have a responsibility in this, is to make sure that the mom is fully vaccinated against all diseases, but you can give a pregnant woman the injectable vaccine during her pregnancy and at any stage in her pregnancy. And that will give her antibodies, and her antibodies are shared across the placenta with the baby. And those antibodies tend to run for anywhere from 6 months to 18 months inside the newborn. And so that baby will be protected until we can give the baby's first vaccine at 6 months of age. Now, the other way of protecting a baby, and this is as important as well, is to make sure that the people that are around that baby, siblings, parents, grandparents, those people that will be holding and cuddling that baby, are also immunized.
So basically, we're creating a globe around that child of people who are protected against influenza, and then the baby is getting a secondary gain by being protected by this.
Yeah, and it actually has a name. It's called cocooning.
There we go. Okay, who would have thought it? The vaccine is certainly not a perfect vaccine, as we discussed. It's not. We guess at what strains of flu may be in the community the following year. We make this vaccine where we hope we're right. So one of the frustrations is that we don't have a perfect vaccine. We take a guess at strains, what's going to be out in the community. We do our best to create a vaccine that's going to protect against it, but we don't know whether we're going to be right or wrong down the road. Where are we in terms of developing a vaccine that solves this problem, one that's likely to carry on from year to year? And every time I read an article, it says, oh, we're 10 years away from the perfect vaccine, and I've been reading that for 20 years now.
Well, when they say you're 10 years away from the perfect vaccine, it means no one has any clue as to what's going to happen. And up until 2 years ago, you're right, that was the stock answer. We had no idea when we were going to be able to get past this yearly influenza vaccine. But now, finally, there is hope in sight. There's, the way we make vaccines is we take that virus or that bacterium, and as tiny as they are, they're very complex things. And they have many different features on them in the same way that a human might have eyes, ears, nose, throat, elbows, armpits. Vaccines have all these different things on them. Those are called antigens. And the antigens are what our body makes antibodies to. And it was just recently, in the last 2 years, that they discovered an antigen called the M2E antigen on the influenza virus, which seems to be there year after year after year after year. So people are working both in England and the United States very, very intensely right now, trying to create a vaccine. In fact, we've got prototype vaccines. It's going to take a while to work its way through the system, but the answer finally has gone from we don't know, or that make-believe 10 years, to 5 years. It's expected in the year 2018 we should have a vaccine that we can get just once for influenza.
And one of the concerns always for me was the thought of a pandemic and whether or not the the vaccine we give now would really have any effect should we have a significant change in the virus and a true pandemic. To what extent does yearly vaccination help with the notion of blunting a pandemic should one arise, and assuming that they're effective in producing a vaccine against the M2E, I think I got that right, not to be confused with R2D2, I'm assuming.
No.
To what extent would a vaccine help prevent against such a pandemic?
Well, it was a big subject of conversation back when we were faced with a possible pandemic a few years ago. And it was pretty clear that people who had the disease from 20, 30 years earlier had some immunity from it. And so it's not likely, strictly speaking, it's not likely that you could count on the protection with a brand new pandemic strain from the previous yearly vaccines for influenza that you've had. But once we get this new vaccine with antibodies against this part of the vaccine that we think is going to be there all the time, it should also be in the pandemic strain, and should therefore the vaccine be protective against a pandemic strain. It's pure theory at this point. We don't even have the vaccine, but it's very possible.
Is this being produced by university or a private company or a public company, or do you know?
I don't know. I don't think it's a public company, or we'd all know, because I think people would be talking about it everywhere and people would want to invest in it. I think the company that's doing it in England is a private company. I know that it's being worked on at least somewhere in Texas, I think at a university, but I'm not sure.
Last question. We've changed our guidelines over the years. We've gone from protecting high-risk individuals and babies and those with asthma, elderly, others, to basically recommending that anyone above 6 months of age be vaccinated against influenza. Have we seen a shift in the rate of influenza in the community because of this policy change?
We don't know. And the reason we don't know is because influenza is not a reportable disease. There are only aspects of influenza that are reportable. If you're under 65 and you die of it, that's reportable. If you're under 65 and you're admitted to an ICU, that's reportable. And if there's an outbreak in an institution like an extended care facility, that's reportable, but other cases are not.
So it looks like there's a lot more tracking that we need to do to try to figure out what's going on, and it sounds like trying to get more places and more offices to participate in tracking is one of the things that will help with that.
Yeah, but we do know the other side of the equation, and that is if you get the immunization, you're less likely to get it.
Got it. Interesting. I would like to thank Dr. Levin for joining me in discussing influenza. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com. And remember, at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ear.